Good afternoon, everyone. Thank you for being here. Appreciate you tuning in. Since yesterday, unfortunately, we have lost another neighbor and resident of Onondaga County to COVID-19. She was in her 60s, had underlying health issues. This is just a grim reminder about how deadly this virus is, and even though we make progress in our fight, we still have people that we lose. So far, we've lost 18 individuals in our fight in Onondaga County with COVID-19. So we're thinking about her, we're thinking about our loved ones, and we grieve with you. We currently have 624 cases. This is up from 598 cases yesterday. 26 more cases since yesterday. When we look at the folks we've lost, 18 individuals, we have 16 of those individuals were Caucasian, one was of another race, one was African American. We've lost 9 males and 9 females. Currently, we have 43 individuals in the hospital. This now represents 16% of our active cases. This is down by 4 since yesterday, so it's a little bit of good news. Normally, the percentage has been about 18% to 20% of our active cases have been hospitalized. So that is a little bit of maybe a trend the last 2 days. It's been under that percentage. We have 21 individuals that are in critical condition. That's 8% of our active cases. That's been pretty consistent. About 8% of the individuals out of our active cases are in critical condition. We define critical condition as you need help to breathe. So we're thinking about them, and certainly please pray for all of our individuals in our community that have this virus, but specifically those who are in the hospital and in the ICU. When we look at the 43 individuals and some of the demographic data that we have on those in the hospital, 23 are Caucasian, 10 are African American, 4 are of another race, and 6 we just don't have the demographic information at this time. Today there are 330 people who have recovered. That is our green curve here. This is up 20 from yesterday. That's good news. That's a good day for recoveries. So overall, we've had 624 positive cases, our red curve. There are presently 276 active cases. That's our yellow curve. That curve is really flattened out, which is good. We need it to start to go down. And then we've talked about how we need our green curve to go up, our yellow curve to go down, and our red curve to flatten. 79 individuals out of our positives are household contacts. We've talked about this for every 10 individuals that become positive with COVID-19, we'll at least see 1 to 2 contact cases of people that live within the household becoming positive. That number is up 5 from yesterday. So out of our 26 cases, 5 of those new cases are contact cases. We now have 1,056 people in our community in isolation and quarantine. That number's gone down a little bit since yesterday. Again, we want to thank especially people who are in a quarantine with really complying with that quarantine. Many of you we know never had symptoms. That doesn't mean you weren't asymptomatic, but never had symptoms and were really in a situation for 2 weeks where you did the community a real solid. So thank you for that. Out of our cases, 339 are female, 285 are male, 18 are under 19 years of age, 120 are in their 20s, 91 are in their 30s, 102 are in their 40s, 114 are in their 50s, 89 are in their 60s, 46 in their 70s, 31 in their 80s, 13 in their 90s. Percentage of breakdown by age, 22% are under 30, 37% are under 40, 53% are under 50, 71% are under 60, and 29% are over 60 years old. Number of cases by municipality. City of Syracuse, 260. Town of Clay, 67. Town of Manlius, 44. Town of Salina, 36. Town of DeWitt, 34. Town of Camillus, 33. Town of Onondaga, 30. Town of Cicero, 26. Town of Geddes, 21. Town of Pompey, 19. Town of Lysander, 18. Town of Skaneateles, 13. Town of Marcellus, 4. Town of Atisco, 4. Town of Van Buren, 4. Town of Lafayette, 3. Town of Elbridge, 2. Town of Fabius, 2. Town of Spafford, 2. And Town of Tully, 2. So we have cases in every town in the county. We've had cases in every county surrounding us. There's been a wide community spread. We've had questions about, can we do the same thing geographically with recoveries? We're looking at that. We don't want to give false hope to folks with that, even if we provide that data, that just because you may have had 2 cases in your town and now you've had 2 recoveries, you can still get this virus. So, but we've had that request. We're looking at it, and we'll try to meet that request. Testing. So far, we've had 8,079 tests administered. 7,921 tests have been returned, with 624 positives and 7,297 negative tests. We have 158 tests still pending, and we received 216 tests back since yesterday. 7.9% of those tested are positive. So when we look at the testing, essentially we're almost in 24-hour turn times, real time. Each day we're receiving back more tests than we had pending the day before. How is that? So many of our testing partners are now getting tests back in hours at some of the hospitals, not 24 hours or 48 hours. So that's important, especially when we look at the reality that we will be living with this virus until there's a vaccine, and real-time testing is going to be critical in our fight with that. We are now doing priority testing for nursing home personnel at the Walmart testing site in East Syracuse. In addition to that, we are now doing proactive testing in assisted living facilities and independent living facilities, and we are looking at strategic testing in senior apartments. Why are we doing this? We know the impact that this virus has on our seniors. We want to be proactive in our testing employees, testing folks who are living in assisted living facilities and living in independent living facilities. For clarification, the state of New York will determine if we can test individuals who live in nursing homes. The state of New York on a proactive basis. We can't make that determination. The state of New York will do that, but certainly we've asked them to consider that. These are examples of when we have resources, how we will go do proactive testing in communities that we know get hit hard by the virus, and some of the communities that we know there's the potential to have outbreak due to density. So we're doing this now. Again, we're looking at our testing triage site being a spot where people in independent living facilities or homes can go to. We're working with Essentia Healthcare to go to assisted living facilities and some of our senior apartments. So we'll be doing this next week. After a positive test, so if you go, you get a test, you put yourself in a quarantine as you wait for the results. That's the law. After a positive test result, you'll hear from our health department. You'll hear from your primary care provider as well if you have a doctor. We'll check in on your health, your symptoms, but then we'll start our investigation into who your direct contacts have been since you're symptomatic and potentially days before you were symptomatic. That's how we then determine who goes into a quarantine. Just because you hear about a coworker who may become positive, works in the same company, the same building, does not mean you had direct contact. Via our investigation, we'll make that determination And certainly if there's gaps in the investigation, if this was an employee working at an essential business, may have had contact with the public, through our investigation, we're not 100% sure if we got to every potential direct contact. We then share that information with you, the public, so that you can then certainly look to see if you went to that business. You can monitor your health, look to see if you have any symptoms. A reminder, we are in a community spread with COVID-19. You should be checking in on your health every day, take your temperature every day. If you have any symptoms, even if they're mild symptoms, contact your doctor and talk to your doctor about that. We have been doing many different social distancing efforts. Our voluntary shelter in place has been really in place for about 10 days. Due to those efforts, we should start seeing some results related to testing. And testing demand related to symptoms. We're now doing proactive testing at the same time because we have the resources. So certainly we hope to see more positive data moving forward related to positive cases. Our best way to fight this virus is to starve it out. And we really need you to be very stringent in when you leave the house. If there's no reason to leave the house, don't. If you need to go to the store, please go on the days that we've suggested and recommended to you. But by starving this virus, we will get ourselves in a position to look at a restart faster. And then even down the road, when we're in a phased-in restart, and that will happen at some point, we still need to starve this virus, or else we'll be in a position where this virus could come back and be prevalent in our lives again. So the best way to do that is to stay away from each other and to give the virus less opportunities to spread and feed. Again, face masks, everybody should be wearing them. It's smart. Other countries have done it. Everybody's doing it. If you're going into a store, please wear them. We're getting reports that some people aren't. If you're an employee at an essential business, it's now the governor's order that you must wear them. Please do that. This is smart. It inspires confidence in your business. It inspires confidence in your citizenry that when you're out, that you're wearing one of these. We know this spreads through saliva, through coughing, sneezing. By wearing a mask, that can help stop the spread. So please do that. It's smart. It's for your own good, your own health. Again, I just wanted to touch on a couple other items, and then we can certainly take some questions. We mentioned earlier our economic development department has put together a tab on their website for who's hiring, and there are many companies that are hiring. If you go to our economic development page, you click on that tab. There's a lot of good companies that are hiring right now. There are many companies that are struggling, many companies that have been shut down or at reduced staffing, but there are companies still hiring. And there are companies that will thrive in this process with new demand for different shopping patterns. So our county website for economic development, www.ongoved.com. That's ongoved.com. Please check that out if you've lost your job, or if you're in a furlough situation, and there might be another opportunity for you. We talked about yesterday about how the central New York counties are going to come together, and we're going to do planning together on what a potential restart could look like. Why do we do that? It's our job. It's our job to plan for a restart, just like it was our job to plan and prepare for COVID-19. We know part of this process is putting together a plan. Part of this process is working with our health departments in central New York to figure out when you implement that plan, when does that happen. That really happens two ways. First, when our health departments feel that they can fight this virus in real time. And so that's one. Two, if this plan were to be implemented before the state was ready via the governor's guidelines, then the governor needs to sign off on that. And so we'll be working on a plan. We'll talk to our state partners about that. And then when the public health data merits this plan going into implementation, we'll reach out to the governor, ask for if the governor feels comfortable with it, and then the governor, in this case, has the authority on that. So that's kind of the process with that. But again, real time, what's that mean? That means we have rapid testing. That means when we have a case where someone goes and gets tested, we know within hours if they have COVID. That gives us time to isolate the individual, find the contacts, and quarantine. The reality is this will be part of our life unless the virus leaves our community and goes south into the southern hemisphere like the flu does. And if it doesn't behave like that, at some point we have to restart. And so we will have to have a COVID tracking team in our health department working on fighting this virus every day in real time. So that's just a little bit more about that, and I can take questions on that as well. The plasma project, again, if you've been COVID positive, you have the ability to partner with Upstate and the Red Cross. You may be part of the solution here to help treat other patients, get them better. Please go to the Upstate's website and register if you can do that. That's fantastic. A couple phone numbers and we'll take questions. Upstate Triage Hotline, 315-464-3979. This is a triage testing site. You don't just show up, you call the hotline. If you don't have insurance, they'll screen you. Or you may call your primary care provider. They may not have the proper PPE or test kits. They'll then refer you. You go and you get tested for COVID-19. Our seniors, our healthcare workers, and adult nutrition hotline, 315-218-1987. Call this line if you are a first responder and or you're a senior who needs help because you can't get to the store, you need a meal, you need groceries, you need toiletries. Call this line. We have volunteers that will help. We've serviced thousands of people. One of the things we did right when this process started. Child Care Solutions. This is daycare for our essential business employees. That includes you and the media here today. If you have children and you got to come cover these press conferences, you count. And what this is we've dedicated slots for essential businesses. You have a need, daycare falls out for your kids, call this line. We'll get you a slot for that day or that week. We've been covering the cost for the month of April. That's numbers 315-446-1220. We talk about the mental toll this is all taking on us. It doesn't get better every day. It gets worse every day. I realize that. And we have help for people that need help. And if you need help, you really should get it. There's no reason to be embarrassed if you're having a hard time with this process every day. 211. Call 211. We have social and emotional support staff there. They can help reference and refer you and help you get through this process. Vera House, no excuse for abuse. If you're in a situation that you are uncomfortable in, please contact Vera House, 315-468-3260. New York State Child Abuse Hotline. Many of our mandatory reporters for child abuse are our teachers, our social workers in our schools. We don't have the kids with us right now. We're concerned about that. If you are concerned or know about a situation, we need you to contact 800-342-3720. Donations of PPE, 315-435-2525. This is the equipment that is so critical for our first responders for COVID-19. This is the protective equipment that is so critical for all of our medical professionals and nursing homes and anyone, home care workers. If you have PPE that you can donate to us, we get it in the hands of the professionals that need it. Again, 435-2525. And our community rallies better than most. And our volunteers are incredible. We've had so many volunteer CNYs. Phone number 315-428-2229. Calling this number they will coordinate volunteering opportunities for you. Again, we thank everybody who's volunteered their time. The stories and the feel-good stories and videos right now going on in our community are just tremendous. And we want to thank everybody who's really stepped up in this process. I will take questions at this time.
Any discussion of extending the voluntary shelter in place?
Yeah, we haven't. We're going to really look at all of the various orders that are going on right now. There's confusion in orders. I'll just address one of the orders right now so everybody understands. We had a couple weeks ago problems with social gatherings. Some of these social gatherings might have been in park-type settings. We put out an order banning golf for a period of time. Shortly after that, the governor puts out an order banning golf across the state. That makes my order null and void. So my golf order is null and void at that point. Yesterday, Empire State Development puts out guidance on private golf courses that allow private golfers to go golf, but they just can't have people working at that facility. So today's answer on golf is if you belong to a private club, it looks like the state has allowed you the ability to go golf at the private club. So I asked the public, don't call my office screaming at me about the golfers at the private clubs because the governor and the state just allowed that. So that's okay. What we don't have all the information on is it doesn't look like public golf courses are open where people can take money and exchange money. So I believe that is still shut down. But so I put an order out. The governor's order comes in, same topic, trumps my order. My order's gone. Now they adjust private courses. You can play on private courses, it looks like. For courses that you can't play on yet, you're waiting for the governor now. You're not waiting for Ryan McMahon now. You're waiting for the governor. The governor has stepped in on this topic. We're now waiting on the state's guidance on that. Did I answer your question? I went into another topic, but did I answer your question?
It answered a good question.
Okay.
To circle back to the nursing home testing and that topic, I was just at the Walmart in East Syracuse, and they started the testing. Now, is that site strictly for nursing home personnel, or is that open to anyone who may need to get tested?
Yeah, so we've worked with them to have a preference for nursing home employees there. And there is still the ability to go online and meet the CDC guidelines of a test, just like any of our other testing sites, and then go there. So you probably have some individuals who are just going there because they're symptomatic as well. But many of the efforts with our adult and long-term care with some of the nursing homes are working with them to schedule appointments on that website so that they can then go out and get tested. So our hope is that the majority of the tests being administered there are for the nursing home employees.
Do you know how many tests were given there today, or do you not have those numbers yet?
Yeah, we won't have that data. Maybe we'll get it tomorrow if they share. They're going to share it with us. This is brand new. I know they had a ramp up. So for the first few days, they only had so many tests they were doing, period. Then they wanted to get to the point where they're doing 150 tests a day there. So, and if the demand is more, then certainly I'm sure Quest can supply more tests for that.
About sort of your orders and the governor's orders, you said that there was some confusion. Is there a way for you to be more stringent than the governor, or as soon as he steps into an issue, is that the final word?
It's a good question, Doug. I think we work really well with the state, so we're coordinating. When I put my order out, it went through a process where the state approved it. I think what happens then, the governor says, okay, Onondaga has an issue. The county executive is probably not going through this process unless there's a issue. There's no reason why I want to get myself into the hornet's nest of golfing if there's not an issue. And so then they allow that to happen. They probably realize in other communities there's an issue too. They put out an order. I don't know why the guidance came out related to private clubs. I'm assuming that private clubs, the owners of private clubs are the members, and they may have a right to that property, and that might be where that comes from. I don't know if that case was made to the state or not. But now, on that issue, the governor came out to the same point we were at. They injected themselves in this policy. We're going to let them take the guidance from here. If we felt that there was another issue maybe where we had a disagreement on, related more to that we felt was a very serious issue related to public health, we believe we still have certain powers in our public health department to take care of business here. I was elected for that, and when I'm elected, just like other elected officials at other with bigger governments, I take an oath, and public safety and the health of the public is the number one thing, and so we haven't had a disagreement, but certainly we think counties have certain rights that we have, and the good news is that we are working very, very well with the state of New York on our response. So it's tough to talk about hypotheticals, but on golf was one where we went through their process. They approved it. They saw a statewide issue. They come in. They got the statewide declaration, the exact same as mine, so I get rid of mine. Now they're loosening some of their guidance. They must think there's a reason why they need to do that. We'll stick with their guidance.
Will first responders be prioritized for testing as well at this Walmart site?
Yeah, so first responders right now do qualify for prioritized testing at Walmart. That's some of their program. And right now, when we have a reason to think that there may have been a contact with the first responder with a COVID-19 patient, we get them testing as well right now. So that's been happening this whole process. From a proactive standpoint, Walmart and Quest's contract with HHS, Health and Human Services of the federal government, said that there's certain things you can test, CDC recommendations, but they said you can do asymptomatic or proactive testing for health and emergency responders. So they are allowed to do that as well. Other questions? Easy crowd today. You guys, this is fantastic. Certainly, I want to give a big shout out to the Ronald McDonald House and Beth Trumfio for allowing their facility to be used for upstate healthcare workers so that they can get a reprieve in that time away as our frontline healthcare workers are doing really God's work every day, and they see this virus up close. So I want to thank Beth. Also, I was very happy to see some of the snow last night. That will help with some of our social distancing bandits out in the community. Hopefully we'll get some more good news with more snow next week, but it looks like the sun's coming back. So everybody else, be smart, stay strong, and be safe. Thank you.